She sits on the edge of a hospital bed, clutching her chest with both hands. The pain is sharp, heavy, and frightening. The doctor looks at the computer screen, then back at her. He shrugs slightly and says, "Your blood tests look normal. You're probably just anxious." Hours later, in another hospital, someone else looks at the same kind of test and sees something very different. Because the numbers were never just normal. They were warning signs, and the first doctor didn't read them for what they were. These stories are dramatized, but based on real types of events that can happen in healthcare. They are meant to raise awareness about medical mistakes and how we can learn from them. They are not medical advice. Always talk to your own doctor or nurse about your own health and test results. Sophie is 29. She sits in a plastic chair in the emergency waiting room, pressing a hand against her chest. Her heart feels like it's pounding hard and sometimes skipping beats. She feels lightheaded, sweaty, and afraid. She has already told herself 100 times that it's probably nothing. She works a stressful job. She doesn't sleep enough. She drinks too much coffee. Her friends said, "It's probably just anxiety." But tonight, the pain feels different, deeper, and the fear that something is really wrong won't let her stay home. In the treatment bay, a nurse takes her blood, puts stickers on her chest for a heart test, and checks her blood pressure. The doctor comes in quickly. He looks at the heart tracing, glances at the monitor, and then opens Sophie's lab results on the computer. The numbers are close to the edge, but still inside the reference range. The doctor thinks she's young. Her test is technically normal. It's probably panic. He sees what he expects to see. He does not ask for a repeat test. He does not consider that normal doesn't always mean safe. Part of her feels relieved. If a doctor says her heart is okay, maybe it really is. But another part of her still feels that deep, pressing pain. At home, the medication makes her sleepy, but the pain doesn't truly leave. She lies in bed, staring at the ceiling, counting the beats in her chest. Some feel strong, some feel weak, some feel like they arrive late. She wonders if she is imagining it. She wonders if she is just anxious. But around midnight, the pain changes. It sharpens, floods into her jaw and left arm. She remembers something she read online. Women's heart attacks can look different, and suddenly she decides she cannot risk being wrong. She calls an ambulance and is taken to a different hospital. There, the team repeats the tests. Another ECG, another set of blood draws. This time, the blood test for heart damage is clearly higher than before. The new doctor pulls up her results and looks at the previous numbers sent over from the first hospital. He sees that her first result was normal, but very close to the upper limit. He also sees that the number is now rising. He doesn't dismiss it as anxiety. He reads the numbers together with her story. Chest pain, jaw pain, arm pain, getting worse, not better. He treats it as what it is becoming, a small heart attack in a young woman. Sophie is taken to a specialized unit. The team runs more tests, watches her heart closely, and starts medicine to protect it. She will need follow-up, lifestyle changes, and perhaps a small procedure later, but she survived. Her heart took a hit, but not a fatal one. The second team treated the lab results as part of a bigger picture, not just a number inside a standard range. Her takeaway is simple. A normal lab result does not always mean your body is fine. Numbers mean nothing without the story that comes with them. In Sophie's case, a second team caught what the first team missed, and she lived. But misreading lab results does not always end with a second chance. Our next story begins with another set of numbers, another busy team, and a patient whose story takes a far more tragic turn. John is 71. He comes to the emergency room feeling weak, short of breath, and strangely confused. His legs are swollen. His heart feels like it is walking up a hill it can't quite climb. The triage nurse takes his vital signs and sends him for blood work. The doctor orders several lab tests to check his kidneys, heart, and electrolytes, the salts in the blood that help the heart beat normally. One of the most important numbers is his potassium level. Potassium is a mineral that, in the right amount, keeps muscles and the heart working well. Too much can stop the heart. The lab results arrive on the screen. Most numbers sit inside the normal range. Some are a bit off, but not shocking. The potassium result is high, but it is marked with a small flag the doctor sees all the time. He thinks, "It's a bit elevated, but I've seen worse." He assumes it might be due to the blood sample being a little damaged, a known issue that can make potassium look falsely high. He does not repeat the test right away. He does not treat it as an emergency. He decides to focus instead on what seems more obvious: John's shortness of breath and his possible heart failure. John lies on the bed, feeling heavier, slower. He is given oxygen, some pills for his fluid buildup, and is told they will watch him and admit him to the hospital. Over the next few hours, the high potassium in his blood keeps climbing. No one checks it again. No one starts the special treatment that can protect his heart from the dangerous level it's reaching. On the monitor, subtle changes appear in his heart rhythm. Little warnings that his heart is not happy with the environment it's beating in. But in a busy unit with many alarms, small changes can blend into the background noise. At one point, a nurse notices that John seems more drowsy. His hands are cooler. His breathing is slower. She checks his pulse and sees that it feels strange, irregular. Before she can call for help, the monitor alarm screams. John's heart rhythm breaks into chaos, then flatline. The room erupts. People rush in, start chest compressions, push medicines meant to calm the storm in his blood. But the potassium, a number on a screen that should have been treated like an emergency, has already done its damage. His heart, overwhelmed, does not come back. Later, his family sits in a small room with a box of tissues on the table. They are told that his heart stopped and that the team did everything they could. What they are not told in detail is that a lab result warned of this hours before, that a simple repeat test and urgent treatment might have changed the ending. On the chart, his death will be recorded as cardiac arrest from high potassium and heart failure. But behind those words is a deeper truth. The numbers were there. They were just not read with the urgency they deserve. Our third story is shorter, and it shows what happens when someone does listen to the numbers. In a busy hospital lab, a technician named Mia runs blood samples through a machine all day. Tubes come in with barcodes, names, and test requests. The work is repetitive, but the results can mean life or death. She runs 2 samples back to back. One is from a young, healthy athlete having a routine checkup. The other is from an older patient with several health problems. When the machine finishes, the results pop up, but something feels wrong. The healthy young patient suddenly has numbers that look like severe kidney failure and sky-high potassium. The sick patient looks almost perfect. Mia frowns. She could simply send the results through. The computer doesn't know the people behind the tubes, but she has seen enough real human stories to know that sometimes the computer is not the one making the mistake. She checks the tubes. The labels look correct, but the timing and the types of tests make her suspicious. She picks up the phone and calls the ward. She asks the nurses to confirm which patient had which tests and when. Together, they realize that 2 tubes were placed in the wrong row during collection. The labels stayed correct, but the order mixed up which sample belonged to which person. If she had just trusted the screen without thinking, the healthy athlete might have been told they had organ failure, and the very sick patient might have been sent home or left untreated, with dangerously high numbers hidden behind normal results. The samples are rerun and corrected. Doctors are notified before any wrong decisions are made. On paper, this is logged as a near miss, an error that never reached the patient. Those patients will never know how close they came to having their lives turned upside down by numbers that did not actually belong to them. But Mia knows, and her quiet decision to question the results, instead of just clicking send, made all the difference. From Sophie's almost missed heart attack, John's fatal high potassium, and the near miss in the lab, clear lessons rise to the surface. Lab results are more than numbers on a screen. They are pieces of a story, and they only make sense when you read them together with the patient in front of you. Normal does not always mean safe. A value can sit inside the range and still be a red flag when symptoms are serious, or when it is changing over time. High-risk results, like very high potassium or signs of heart damage, cannot be brushed aside as probably just a lab error without checking again. A repeat test can be the difference between catching a problem and watching it explode hours later. Near misses matter. When someone in a lab or on a ward catches a mix-up or questions a strange result, it should not be ignored or hidden. Those moments show where the system can break and how it can be fixed. And for patients and families, it is important to know you are allowed to ask about your results. You are allowed to say, "These numbers don't match how I feel. Can we look again?" If you got a call that said, "Your tests are normal," would you feel comfortable asking, "What exactly did you check, and how sure are you that it fits what I'm feeling?" Or would you stay quiet because you don't want to bother anyone or seem difficult? Sometimes one extra question from a doctor, a nurse, a lab worker, or from you can turn a misread number into a life saved instead of a life lost.